I'm Dr. Rian Maercks, a Miami Beach plastic surgeon, and I felt compelled to make this mini documentary about aesthetic facial balancing. I decided to enter my own practice as a patient and treat myself as I would anyone that walked into my practice. The only difference is, with myself, I took things to an extreme of volume that I wouldn't recommend for a patient. To drive home the point that I can put 35 syringes of Juvederm in my own face, more than I'd recommend for any patient, and still look human, normal, and rejuvenated. I'd always commonly encountered patients who say, well, you're going to inject my face with 6 syringes or 8 syringes of Juvederm. What do you need or what do you do? And my response was always, I don't do anything to my face, but if I did, I would get a minimum of 8 syringes of Juvederm and probably a lot more. So one Saturday morning I decided to analyze my own face and started injecting. What you see now is me a month and a half after I placed 35 syringes of Juvederm into my face. I could even keep going. I just can't afford to. Like I suspected, 8 was not enough. So we're at 14 syringes in my face. Wow. It's really creepy watching myself get younger. It's a bit of a surprise to walk into a plastic surgeon's office expecting a typical nasolabial fold fill or a lip augmentation with a filler and have the plastic surgeon explain to you for one subunit of your face you need 4 or 5 syringes of Juvederm. And to balance your entire face, it might take 8 or more syringes to get things looking right. They're used to people injecting 1 to 2 syringes to smooth out a line next to the mouth or some crow's feet. That's not what I do. What I do and why I use what's thought of by some as extreme levels of volume. The reason I do is it doesn't make sense to treat a line in the face and not change the perceived aesthetic value of the face. What I do is balance a person's face to bring out the beauty that's there. Erasing a wrinkle does not do that. Leaving a wrinkle alone and changing the shapes, the space, negative space, light reflexes, and shapes around the eyes, nose, and mouth allow the observer's brain to see beauty that was not there before. This is the concept of aesthetic facial balancing. So here we are at 21 syringes in my face, and I'm having a hard time stopping because I'm not completely corrected. I personally never expected to inject my face. It was really just the opportunity I saw to better relate to my patients, better understand the experience of what I put them through. Injectable fillers are really trivialized by the media and perception in the public. So when people come in for injectable fillers in my practice and I talk to them about facial balancing, it's really a foreign concept that's difficult to comprehend. It also is very hard to convey to the patients that for 2 to 3 days they may be more swollen and unhappy and go through some psychological changes adjusting to their new face. Haven't seen that face in a long time. People aren't going to trust me as a doctor anymore. I'm a little too young. So I really thought this was a great opportunity to put myself through it and relate to patients and say, I've been there. You can see me go through it. My eyelids are totally numb, so it feels like I can't see. And so I totally understand what I hear from my patients. Sometimes when patients get anxiety, they say, I can't see. And what they're conveying is the sense that you feel like your eyes floating off your face, and even though you're processing visual image, it feels like you can't see. And that's what this video is really all about, to understand what the goal is and decide if an aesthetic facial balancing procedure is for them or not. So what I've done to my face now is the goal of most of my corrections. A really subtle correction where the bags under my eyes don't go away. They're just less pronounced. They're not going to attract your eye and make you think I appear older or more tired. Right now I may not appear great because I'm a little bruised and swollen. When it goes down, we'll have a nice subtle redefinition of the malar fat pad and a blunting of the several indentations I had in my face under my eyes. And I won't look like anything was done, and that's really the goal for all my patients. I couldn't afford to look done for my profession, and my patients can't afford to look done. So this has been quite an experience.